Okay, welcome, ladies and gentlemen. My name is Dr. B, stress free. And I tell you, I came up with that name. I did research on how to identify the stressors and coping strategies of women in leadership within corporate America, education, and governmental agencies. And in today's society, we are just so stressed out. And so, I just decided that I wanted to be able to bring people together, bring them together to just be able to communicate so that we can educate and motivate our community. So I've got a lot of professionals on here. I've got a few special guests, and I just want to really highlight one individual. She doesn't even know I'm gonna call on her, but I'm gonna call on her anyway, because that's what I do. And that's Miss Dr. Janice Adams. Dr. Janice Adams, tell us just a real little bit about you. We're gonna feature you somewhere along the line, but I'm just so happy and elated to have you on here. Let us know what you do and what you're involved in and a little bit of your background real quickly.
Dr. Patricia Bernard, you sure did
I put
catch
you on the
me
spot, didn't I?
off.
Yes, tell us a little bit about yourself. I'm proud of you.
Oh, I oh,
He's caught
what
off guard, you guys.
yeah, you sure did catch me off guard. Anyway, I graduated with this wonderful lady that is put together this podcast. And I mentioned last week that she never ceased to amaze me with all of her talents and what she brings into the world. And this podcast, I think, is so fitting for her to lead the charge on it because it's so needed. We all experience stressors in our lives, whether we realize it or not, and to be able to have a community of like-minded people to meet with on a weekly basis or monthly basis or whatever is so beneficial for our well-being. And she wanted me to tell you a little bit about myself. And for the last 3 years, I've been fully focused and developing my academic studies and development in mindfulness. And I became a global teacher for mindfulness and how we can meditate in this fashion to help alleviate a number of stressors that we all experience. And there's a number of variations of that, but I specialize in mindfulness um, process of all of that. So, anyway, I'm happy that Dr. Bernard has put together this community for us, and I'm looking forward to learning from all of you and what she brings every week to offer us.
Well, thank you, Dr. Adams. And she retired from Generous Motors. She didn't tell you that part. But we're going to learn more about her in the future. She's doing a commercial right now on mindfulness. How many people want to be in tune with mindfulness? If you really think about it, that's a whole different art in itself, and it's all about relieving stress because people are so stressed out in today's society, and people are trying to figure out a way, and besides self-medicating and doing a lot of extra things that that they don't need to do because they end up having more problems than what they really need to have, right? Um, so I'm definitely interested and intrigued by mindfulness. We definitely will be featuring you, Dr. Janice Adams. I know I caught you off guard. That's how I do it. See, that's what makes it so unique and authentic is when you catch people off guard.
Well, you did.
You did a great job. So,
Thank you. But
so okay, everybody. Well, number one, I want to thank you guys. People are still joining us, and that is fantastic. And welcome to Dr. B Stress Free Real Talk for You. And I tell you what, we always have great topics. If you have any examples of something that you would like for, or topics or things that you would like for us to talk about, let me know. I'm sure I can find an expert that can put it together for us. And so I'm really, really elated today because I have a young lady, and I don't know if any of you all have ever gone to a chiropractor, but I've never gone to a chiropractor. And I have an interest in that. And I hear my son tell my mom, I got to go to the chiropractor. I'm like, is that a new fad or what's going on? And I know people have, their own opinions about chiropractors or what have you, but I had a pleasure of meeting this young lady, and I spoke with her, and I'm excited to introduce Dr. Tashia, I'm sorry, Dr. Tashia Reid, and she's a holistic chiropractor and functional medicine practitioner. And so she's coming here live from Orlando, Florida, in that area, and she's going to educate us on why it's important to even consider a chiropractor. So, Dr. Reid,
Yes, ma'am.
how are you today?
I am doing great. I am doing great. It's Tasha. It's a silent I. I know it just messes people up. I know. I know. It
Oh,
just
okay, so I
it
did
just
say it right. Okay, I didn't want to
it
sound
just it throws people off. It's just Tasha.
oh,
But
that's
I mostly say Dr. Reed for people because it's usually kind of
professional.
uh mispronounced, but it's okay. It's all good. I've been
Well,
on this earth for
okay.
48 years and yeah, I'm used to it.
Well, you know what? I just want you to know that it's a pleasure to have you on. I'm excited.
Thank you.
Again, just the fact that it's alighting our communities, because a lot of times we just don't know, um, and we don't understand when it comes to doctors and what they're doing and what's required and all that. So just tell us a little bit background about yourself.
So I am a holistic chiropractor, and I am also a certified functional medicine practitioner. And basically, to sum all of that up, it basically means that I look at your whole body health. And I'm not just looking at your spine. I'm not just looking at your neck, your back. People come to me for things beyond the typical pains, which is usually what drives people to a chiropractor in general. I have neck pain, I have back pain, I have shoulder pain. And so I go beyond that, looking at your whole body health. So if you're also a diabetic, if you have high blood pressure, heart disease, all of those things are going to play a role in how you recover from these other things, because at its root, a lot of it is inflammation. And so I look at all of that. And I've been practicing for almost, 23, 24 years. So I've been doing this for a while. As you're reaching over your beach scene.
Yes, I'm reaching over. What's happening is I'm actually trying to close my blinds because these lights are kind of okay.
Okay. I thought it was snowing there. What are you talking about? You got sunlight
Well,
coming
that's
in
why I
there
have to
now?
have the beach right now because I left Florida last week and it was 80 degrees, and now I'm in Michigan and
Yeah,
it's snowing out.
it's still about that point too.
So let me ask you something. You mentioned something regarding, and I know you said that your dad was in the military, right?
Yes, ma'am.
So you've been able to travel the world, which I find is always interesting. And my dad was in the Air Force too, and
Hmm.
I think that helps make people a little well-rounded. We kind of get a little bit of meeting friends,
Yeah,
losing friends, and having to make more friends. And
yeah. I think it was probably maybe a little bit different for me because I was younger when we were traveling. My brothers, which are older than me, they were I guess in junior high, high school during that time. For me, being much younger, it was fun times. It was, play in the snow. It was like, oh, we're going somewhere else new. It wasn't a big deal so much for me. But I also appreciate those times of being able to travel, being in different countries, coming back to Florida, realizing how hot it is. I'm not a heat person, but I've been here most of my life.
so, where's your practice located?
I'm in Castleberry, which I
Okay.
always tell people if you sneeze, you have driven through Castleberry. So some more prominent cities that I'm close by or Winter Park, Altamont Springs, but basically the kind of greater Orlando area. And I've been in this location for, gosh, about 4 years now. And like I said, total, I've been practicing for almost 24 years.
Wow, that's exciting. That's exciting. So tell me exactly, what is a chiropractor? I've heard a lot of people say, I got to go get my back cracked. And I said, oh, that don't sound good. And I just hear all these different tales. And, I know it's like
Mhm.
stereotypes and stuff like that. So just let me know, or let us know, let the audience know what a chiropractor is and why it's important for one to consider.
And it is a lot of stereotypes, misconceptions that are out there. We call us the bone doctors or the spine specialists sometimes. One thing is that we are real doctors. Sometimes people, we are chiropractic physicians. We go to school. It's not just a 6-week program that we go through. It is a
I hope
rigorous.
not.
And if anyone tells you that they did go through a 6-week program, they are not a chiropractor.
No, I'm
So
gonna keep running,
do
right?
not let them touch you.
Don't worry.
So we go through just as much schooling as medical schools. It's just chiropractic schools, and most of our focus is on the spine. And because at the root of it is that's where everything originates: your central nervous system, your brain, your spinal cord. And so from your spine, your nerves come out, they supply your muscles, your joints, your ligaments. And so with chiropractic, we are focused on the musculoskeletal system. So the muscles, the joints, the bones. And yes, people do call us the back crackers, or going to the doctor to get their back cracked. That is the common term, but uh, I'm not offended by that term. Sometimes people are offended, like it's not cracked, or it's not getting cracked. It's actually called a manipulation. What we do, a spinal manipulation, or extremity, like your shoulder, your joint manipulation. But you do hear that popping sound, and sometimes
Mhm.
that is what kind of excites people, but
Oh,
then
really?
also
They get excited
scares
by
people.
having they why they get
Some
excited?
people do get excited, like, I didn't hear anything. It's like, yeah, it's okay. It's okay. Um,
So I got a
so
question. This is an ignorant
yes, ma'am.
question. So if you hear all this popping and going on, does that mean the person has some serious problems, or is that a good thing or a bad thing?
Not necessarily. Sometimes it may just be a lot of joints that are releasing, a lot of joints that are restricted. So when I see a new patient for the first time, we're still going through a history, we're going through an exam, orthopedic exam, testing, neurological testing, range of motion, because we want to make sure that there's nothing that is contraindicated as far as what I'm going to do with them. As well as I walk people through what they're going to do. I kind of look at, okay, have you ever been to a chiropractor before? Or if not, this is your first time. Okay, we're going to go explain things a little bit more, slow it down a little bit more. So, because sometimes it can be overwhelming, it can be scary, as well as sometimes people do have misconceptions of what's going to happen. You're going to crack my neck and I'm going to just fall over. No, that's not what's going to happen. That's not what's going to happen. But we go through an examination and we do what's called palpation, which is where I'm feeling along your spine, feeling along your joints, seeing how they're moving, seeing how your muscles are interacting with the joints, and then that's when I decide to do an adjustment. So there's a lot of videos out there. A lot of people see videos like on TikTok or
Mhm.
Instagram, and usually a person getting adjusted, they have a microphone next to their spine, and so you hear that loud sound, but it's not actually your bones that are cracking or breaking or anything like that. It's just normal gas, air that's in the joint, that when I manipulate it, it releases and makes a sound. So I'm
Wow.
sure most people on here have probably popped their knuckles before, got bent and pop. That is a form of an adjustment. It's just not done that way. If I am adjusting someone's fingers or toes, I do it a little bit differently. So contrary to the misconception, your mom or your grandmother may have told you, oh, don't pop your knuckles, you're gonna get arthritis.
Right.
No, that's not
That wasn't
that's not
true.
how arthritis works. But a lot of people that do have arthritis or what we may say degenerative changes do go to a chiropractor. Because we help to get some degree of motion back into those joints. So again, most people are driven to a chiropractor or one of us because they have pain. I tell people pain is usually what drives it. If we have a symptom, then we're going to go get something done. But also people come for wellness. Like I want to stay healthy. I want to stay having good range of motion in my joints and flexibility. And so people may go once a month or once every few months or even, every week
Mhm.
to get treatment of some degree. So it can be very, very beneficial for people, specifically to the musculoskeletal system. But then there's so many other wide ranging benefits that people experience. Like I'm able to sleep better. I have better digestion. I can just breathe better in
Really?
general. So there's a lot of different things that are may not be the main thing that someone went to the chiropractor for, but they may notice other things that start to feel better or improve because of it.
So let me ask you, because again, I have never gone to a chiropractor, so this is very, very educational for me,
Mm-hmm.
and it's very, very interesting. So as we grow older, because all of a sudden I start when I go up and down the steps, I hear my bones.
Mm-hmm. Like you don't
I
feel
hear,
like a spring chicken anymore,
no,
right?
it's like
Yeah.
I get up in the morning, I'm like, ugh, I've never heard that before. What is that? What is going on with me? Besides my big
It can be different things for a lot of people, and this is by no means I am not calling you old or anything like that because
like, watch it.
we are all aging. And I will always credit this to my mom because she always tells, she's like, I'm not old, I'm mature.
Yes.
So we're all aging and we're all getting mature. And what happens is things change, that you're not 15 years old anymore, you're not 25 years old anymore. So as your body is going through different changes, it's all about how are you aging? Are you aging in a healthy way? Are you aging in an unhealthy way? And so there's going to be a lot of different things that are going to play a factor in that: exercise, nutrition, chiropractic care. It can be very, very helpful as being kind of like that trifecta with things. And that's why I talk to people about all of those things. It's not just, okay, come and get your back cracked or your knees cracked and everything like that. It's got to be that whole body health. So when people start to feel, and sometimes it can be one of those things that seems like it comes overnight, like you were perfectly fine on Monday, and then all of a sudden you woke up on Friday and you're like, why is my knee hurt? Why is my back hurt? Why are my bones cracking when I go up the stairs? And, why does it feel like my hip is going to pop out of place? And those are, again, the symptoms, but it didn't start that day. Those have been things that have been leading up through the years, things that you've probably been ignoring. The symptoms have been tapping you on the shoulder saying, hey, Dr. B, you should go get this checked out. And you're like, nah, I'm fine, I'll go away, I'll just take some ibuprofen and it'll be fine. So I usually see the people that the problem has been going on for years
Mm.
and years and years. And I tell people the longer something has been going on, the longer it may take to start to see a difference too. The Rome was not built overnight. Your body did not get like this overnight. And the older we get, the harder it is to start to see things turn around very quickly. And so
Okay.
I always use the term, you're not a spring chicken anymore, because we're not. I'm not a spring chicken anymore. But
Okay, I got a question on that. So you're saying the older that we get, the harder it is. So are you referencing the fact that should we be considering a chiropractor and having some type of maintenance done along the way? Would that be it? Or we just
absolutely,
show
at
up
least.
as a wrecked car and we want you to fix us? How does that go?
Exactly, exactly. And sometimes people are just in general, as people get older, they may be a little bit more cautious of, oh, I don't want anyone pushing on me or anything. But that's like the perfect time to go. Like
Mm.
it's still necessary. It's not, chiropractic is not just for a certain age group of, okay, only from 18 to 35 or something like that. That's on, just in that bubble. It can be from young to old, from babies to elderly.
Oh,
Um, I'd say probably my oldest, most mature patient that I have is in their late 70s, early 80s.
oh wow. That's
And so
interesting.
when people and a lot of patients that come that are older, they've been doing it for years. They've been doing it for decades. As well as there's those people that, hey, 60 years old going to a chiropractor for the first time, but it's never too late. But also you can't expect things to also turn around. If you have severe arthritis in your neck and you can only turn this far, you're not going to become an owl overnight because I did one treatment on you. It takes time, and it takes a lot of different, sometimes different resources helping with that as well.
I have a question because I know I always get when I'm stressed or when I'm working a lot in my neck, I can do just like this, and I just feel it like snack pop, snack crackle pop. You know what I mean? I feel
Hmm.
things happening. What is that? Does that mean is that a good thing? Because I had someone tell me, "Oh, my chiropractor told me that you don't never want to roll your neck or do that. That's not good." Does that
You know,
in alignment?
you never want to just try to crack your neck. If you're just stretching your neck, normal range of motion, you may feel or hear some things kind of pop and release. And that's just your body just trying to kind of right itself like, finally she's doing something. But in terms of she's finally moving. But so
But well, I've been trying to play
I
lately.
like to add a lot of humor
No,
in
I understand that. That's how people.
what I do because I know that it can be um sometimes overwhelming and nervous for someone to come not only to the doctor but to someone that's going to put their hands on you, and they have to trust you and everything. So I like to diffuse things with humor and laughter a lot of times too. But yeah, it can a lot of times it can just your body just trying to kind of right itself. So you may hear things kind of pop or release spontaneously, and you feel that release. Even more so, I'd say that's an indicator that you need to get to a chiropractor.
Oh, so I need help, huh? Okay, so let me ask you this. No, because I'm gonna make an appointment to come see you. Hopefully I can afford you.
$500 million for the first visit. Just kidding.
I'll probably have to. I might have to come there and work for you for a little while.
Right.
So tell me, so if someone wants to make an appointment with you, what type of insurance do you take, or is it cash and carry, or how's that work?
Both. I actually take, I'd say most of your major insurances, Blue Cross, Aetna, even Medicare. So that's why Medicare does cover chiropractic care. They only cover, I say what you call basic chiropractic care, which is just adjustments. They don't allow us to get into doing therapies and physical therapy and that type of thing, but it does provide some coverage for active issues up under Medicare. So most insurances, as well as self-pay if someone doesn't have insurance, we
Mhm.
have self-pay packages and everything for them as well too. So I try to have or allow access for many people for it. Sometimes people don't they tend to not want to do the things that will help them and take care of them. Sometimes people are more so used to the traditional medical side, medicine.
Mhm.
Take some medication, take some ibuprofen and everything. So we have typically been up under the umbrella of alternative medicine, but chiropractic shouldn't. There's nothing alternative about chiropractic. It is holistic, it is mainstream, and I just try to educate people as much as possible as far as what chiropractic can do for them. Yes, it has limitations, and it's not. I would never tell someone like, "Oh yeah, I'm going to do this and I'm going to cure you, and everything's going to be fine." And you're not going to have any problems, but I'm going to give you all the different options and what you need to do for things to change.
Well, I'm just not, thank God right now I take no medicine. If I get a headache, I just go to bed, and normally when I wake up the next morning, I'm good or whatever it might be.
Hmm.
But so I hear you saying it's not alternative medicine, but how often do you think someone should see a chiropractor?
It depends on the person, it depends on what's going on. If I have someone that, um, for instance, I'll use the example of, having a car accident, because
Mm.
a lot of times chiropractic is associated with you
Yes.
get in a car accident, go see the chiropractor. So that is a common thing here, especially in Florida.
Well, there's a
So
lot of
that's in a
accidents in Florida. My God.
yeah, there's a well, you know what? A lot of that is people from out of state come to
Oh,
Florida
is that what it is?
and they can't drive and they don't
New
come to
Yorkers.
stay.
It's not the Michiganders. It's the New Yorkers.
They're
Bonk
not
and fire horn and
they're
stuff.
not obeying those simple traffic signals and everything, you know. So yeah, Florida is very, especially Central Florida, is very notorious for car accidents. So that's a acute type of situation. That's something that's happened fresh. So someone like that, I'm going to see them more frequently
Mm-hmm.
versus, I do have those wellness patients that, you know what, they don't have any particular complaint or musculoskeletal complaint, but they realize that when they get adjusted, they feel better, even if they didn't come in with an actual complaint. Like, wow, I feel looser. I feel sometimes people feel taller after they get an adjustment.
Really?
Yeah, like, wow, you can stand up straight, stick your chest out, keep your
Right, right.
everything. So, so for those type of people, it might be helpful once a month, once every few months. I have those. I tend to kind of meet people where they're at. Sometimes I do have those people that literally will just come in if there's a complaint. They're not so much interested in the maintaining in between. So I may see them a few times, and then, they disappear for a few months and then give me a call. Oh, I fell off. I fell off my bike again. Okay, let's get you in. Um, and so, but I try to always educate
That's not
people.
funny, but I'm just
No, it's not, but but I
oh,
always try to educate people on the overall benefits of it in terms of preventative, as a preventative type of medicine, as well as for acute and chronic conditions as well.
wow. So in educating people, which is what you're doing today, and we really appreciate you. You're doing a great job. So as we grow older, do you feel that we may have more of a need for a chiropractor? Or is it something that, because I know young folks that are going and they use it as, like once a month, I gotta go see my chiropractor. I said, well,
Hmm.
okay, see,
I don't think it's necessarily a thing that's just as you get older, you need it more. I think it's just a way we are getting older. I think it's the state of the population, the state of
Mhm.
our health in general. You're seeing, some of the younger people are more aware of the things that are going on with them. No offense to the if anyone is of the younger generation, sometimes they may be even hyper aware of the things where it's like every little thing, like I coughed, I
Right.
coughed. And
Exactly.
so so that's but it's a good thing, but because you do have to be aware of the things that are going on with your body. I'm not with you 24/7, and so you have to be aware of those things and being mindful of those things. Sometimes, if the older generation, you come from more of a older traditional where you didn't complain, you didn't talk
Right.
about things, and so, oh, I'm fine. Secretly you're I'm so much pain. I'm fine.
Right.
And
Right.
so it's not so much that older people necessarily need it more. It just depends on that particular person. And, again, we're all aging. It's just a matter of how are you aging? Are you aging in an unhealthy way or a healthy way?
Right. And we really want to, I know everyone on here because we love to travel, most of the people that I have on.
Hmm.
And I said we travel to unravel, but I tell people too, you have to be able to carry your suitcase. You got to keep it moving. Nobody wants to
Exactly.
wait for you all day to get off the airplane.
True.
I mean,
True.
no, really, you have to be in shape to do that. And I know some of us are starting to play pickleball, and I've been playing tennis, and that's good. But
Mhm.
there's some little falls that come with that. But I think the more exercise that we get, the more agile we are, so that if we
Mhm.
do fall, you can kind of catch yourself a little bit better than if you're all stiff, right?
And it's kind of like it's a multi-prong approach. If you just have someone that's just exercising, and exercise is great. That's a large component of health and healthy aging, keeping those muscles strong, maintaining that flexibility, keeping those joints lubricated, so to speak. Chiropractic is one of the other parts of that, to help not only with those aches and pains, but to help your body to recover better from injuries when they happen, because you're already in a better state versus an already dysfunctional state and having an injury. And then the other part of that is nutrition. What we're putting
Right.
into our bodies. It's either going to help you or hurt you. It may do that right away, or it may do that down the road, but it's going to be a factor in things, as well. And so that's why I talk to people about all of those different uh, aspects of things. Yes, they are typically coming to me for the chiropractic, but they're going to walk away knowing, okay, do I have this particular disease? How is that affecting this pain that I have? How is that affecting the way I recover from this particular injury? And so it's very, very important overall.
Wow. Well, I'm looking at the chat. The chat is blowing up, and you're getting ready to get you some customers. So I hope.
No, no questions. No, I was kidding.
Oh, well, I'm saying customers, but I'm going to see if they have any questions. So, Miss Barbara, do you want to unmute yourself? You had a question about vitamin deficiency? Miss Barbara? Okay. Well,
Yes.
okay.
My question was, with sciatica nerve, is that something that the chiropractor can help with, or is that a lack of a vitamin deficiency or something?
All the above. It's well, the first part of it comes down to evaluating. Sometimes people do ask the question, can chiropractic help with this or that? Part of it is getting to the root of what is it coming from? Is it true sciatica? Is it, an actual pinched nerve? Is it coming from a disc issue in the neck or in the back? And so there's different layers to that. Up under that, because of the inflammation that's there at the root, causing now this sciatica, this leg pain, there is also going to be those nutritional deficiencies that are most likely there as well.
Did she answer your question, Miss Barbara?
Yes. What vitamin you recommend for that? There's a B vitamin that
I'd
you
say definitely. I wouldn't even single out one necessarily one single B vitamin, but definitely your B complex in general is going to kind of cover bases. That's one aspect. Excuse me, one aspect of it. Yeah.
Okay, thank you. Yes, she did answer my question.
Wow. Well, thank you. Miss Theo, Cameron, you had a question? You have a hand up?
Hey, Dr. Reid, nice to meet you. My name is Theo.
Love the.
Um, I, Dr. Pat, no, I'm trying to put my hand down. There I go. I, I have traveled with Dr. Pat, and Dr. Pat probably can remember when I was in so much pain on one of the trips because I had forgot my medication. But I have a diagnosis of bulging disc in my lower back and sciatic nerve.
Mm-hmm.
Herniated disc in my neck, and I also have a sciatic nerve, but I work on that sciatic nerve by doing what was shown to me in PT. So, and I have also, I self-disclosed some information about myself at the last podcast. I have 30 years clean from drugs and alcohol. So I know throughout that process of when I was in that moment in my life, I did some damage. And I'm
Mm-hmm.
well aware of that. But I want to ask you a question because I was seeking some help, extra help besides what I was doing and PT and stuff. Have you ever heard of decompression therapy?
Yes, that's actually one of the things I have in my office.
Ah, okay. I was just so like, what are your thoughts of, well, I mean, what is your insight on it? Because I saw it on the commercial, so I wasn't really sure about it, and they didn't
Hmm.
take my insurance. They wanted me to do like I guess one of those things where you apply for credit, medical credit or something.
Hmm. Like care credit. Yeah.
Yeah.
And that's because it's not something that is covered by insurance. So even in my
Is it
office,
then?
it is
Okay,
a self-pay service,
gotcha.
but it is
Okay.
very, very helpful. I do it for the low back as well as the neck, and
Yes.
tremendous results
Okay.
with it. I've used it with uh, acute care patients, like car accident patients, but I've also used it with chronic disc herniations, disc bulges,
Okay.
even with arthritic degenerative changes in the spine. I use that as well. But yeah, it's a beautiful treatment. If a person puts in the commitment to it, because it's not one of those things
Right.
that's a one-time thing. It's you do
Right.
have to commit. So I do put someone on a treatment plan with it, but reevaluating things every visit, what's going on, how are
Right.
things improving and everything. So it's not
Okay.
something that is a lifetime treatment, but
Right.
once you get through that initial phase of care, the whole goal is putting you on more of a maintenance type of
Gotcha.
treatment with it. And then sometimes people then have like get like the inversion tables to have
Yes.
at home to do
Yes.
in between that type of thing.
Okay. I was just, thank you for enlightening me on that and educating me. I was
You're
just
welcome.
worried because one, I had saw them on TV. Two, when I got there and I told them, I said, well, I have TRICARE Humana. They was like,
Hmm.
no, we don't take that. We don't.
Hmm.
They know I use that. I'm not saying they don't take that. And then they was like, you got to do it. You have to do the treatments. Like you cannot skip. I don't know.
Yeah.
It just made me feel uneasy. I just felt I was like, this might be a scam.
Yeah,
But
I mean yeah, I mean sometimes it's hard for people to accept things, certainly, it's on TV, it's commercial or whatever
sure, sure,
the case be, you don't know that person or
right,
you're not in the
absolutely,
office. So, sometimes it's the way that it's presented. When I present it to someone, it's not, forcing. It's like this is the options. This is the conservative, non-invasive approach to it. It's not going to be overnight. It's going to take some time. It may take a few months for us to see a difference, but the alternative is, okay, do you want to have injections? Do you want to have surgery? And so you have to, decide, okay, which route you want to go, conservative or down the road of, constant injections, pain management type of thing. And everyone is different, with it, but I always guarantee people, you're going to see a difference with it if you put in the commitment to it.
okay. Thank you very much.
You're welcome.
Wow. Now I got a question because I had one of those invert
Inversion
things.
table.
Yeah, and I gave it to one of my sons and I thought maybe I should have kept it, but it probably would be in the garage with the rest of my stuff. So I never did really use it. But so are those really good for people? What do you
Yeah, I mean, it's not a specific decompression in terms, like when we do decompression in the table or in the office, we have it's specific to either doing the neck or to the low back. And so at that area is isolated, so that the decompression is occurring in that area. With the inversion tables, you could look at that as kind of like a a general type of stretch, a general type of decompression. So it's going to be probably more effective for like the low back versus you're not going to feel much when you invert yourself upside down going into the neck area. But it can be very helpful to have at home to do on a daily basis. And I do have had patients that have it at home to just do in between treatments. They may come in for once a month to do the table here, and then they do the inversion table at home on a daily basis.
Okay. All right. Very good. Well, I'm putting in the chat your so your website is drreidwellness.com. Is that correct?
Yes, ma'am. Dr.
Okay.
Reid Wellness.
Yeah, I was actually chatting in here, but I think I was sending it to one person instead of everybody. I'm sorry. I had one person send me a lot of messages. Well, we got quite a few people on here actually from Florida, Daytona Beach area, Tampa area,
Hmm.
as well as people here from Michigan and so on. So, those from Michigan, they'll have to get on a flight to come see you, but I'm not that far away from you, so I'll be glad to come and check you out. So,
Hmm.
does anyone, that's why I want to open up for discussion now. Does anyone on here have any questions? Just unmute yourself and let us know who you are and ask your question quickly, please.
Great evening.
Oh, we can't hardly hear.
Oh, we can't hardly hear.
We can't hardly hear you.
Hello.
Okay, we can hear you now. Yes. Let us know who you are and where you're from.
This is Regina from Daytona Beach. I have a comment and a question. So as the chiropractor, I believe in it. It's I recall I had I didn't know what it was, but all I know was it caused me to want to just curl up because I just got out of bed one morning, started walking, all of a sudden I felt this shooting pain and I couldn't put no weight on it. And so they said it was sciatica, and I went to a chiropractor treatment, haven't had that issue since. So I really believe in it, to incorporate it in part of my health and wellness. As for a question for Dr. Reid, how do you feel? What is your opinion about the red light therapy? I know my chiropractor, she has that in her practice. So I just want to know what your opinion of that. Thank you.
I haven't used it so much on patients. I have used it on myself. I'm from the school of thought of, if it helps you, then that's what matters most, because just like medicine isn't for everyone, chiropractic isn't necessarily for everyone. Some people don't like acupuncture. I'm personally not a fan of having needles in me laying still. I have nothing against acupuncture at all, but it's a matter of finding what works best for you. So I do definitely support red light therapy by any means, and there's a lot of different therapies and treatments that are out there. Some of them we do, yes, incorporate in with chiropractic care. As I said, I am all about whole body health. So, whatever different things that can be helpful for the whole body.
Wow. Did that answer your question?
Yes, it did. Thank you, Doc.
You're
Okay.
welcome.
And she's from Daytona Beach.
She's from Daytona Beach.
Yeah.
Good evening. Can you hear me?
Yes, we can hear
Mhm.
you.
Yes, we can.
Okay. What a great presentation, Dr. Tashia Reid.
Thank
This
you.
is Maureen Chidalayanzi. I'm originally from Zimbabwe. I live in the area of Daytona Beach.
Mhm.
You are speaking, you really got my attention because you're speaking my language, health and wellness.
Uh-huh.
And I actually started on Cairo when I was rear-ended in my car. And, I did some treatment and I got hooked to it. So when I was done with my treatment, I promised myself I have to visit once a month.
Mhm.
And I kind of feel terrible when I skip a month.
Mhm.
And it's funny that you said you get taller when you get adjusted. It happened to me because I had a bad knee and I was limping like grandma at one point. But because of my chiro, I can run now and walk the bridge without limping. And I feel
Nice.
taller. And so I'm really, really interested. I have a chiro here in Port Orange that I've been visiting that I really like. He's an old school, so he uses the new school and old school ways.
Mhm.
And I like them both. But I would like to visit you, especially. I'm just impressed to see our own sister chiro, because every chiro I go, I see the other people.
Mhm.
I don't mean to offend anybody, but it's nice when you see a sister that look
Yes,
like
ma'am.
me.
Yes.
Yeah, so I want to visit you in Orlando. My health and wellness is part of my living as well as travel. Like I tell people, health and wellness and travel is like eating every day. So I don't mind paying if the insurance doesn't pay. I don't mind. I have a care
Mhm.
credit. So I would like to visit you and just see what you can do for me.
Absolutely. Absolutely. Give us
And
a
thank you
call.
so much for our mentor, Dr. Patricia Bernard. If it wasn't for her, I would not be meeting you on via Zoom, Dr. Reid. So, Dr. Patricia Bernard, I really thank you for all you do. You really connect people. You really, Dr. B, stress free. Thank you, thank you, thank you. Love you.
Oh, wow. Love you too.
Wow,
Renee.
love you.
So does anyone else?
So, does anyone else?
All right. Well,
All right. Well,
I don't know why I got
I
to
don't know why I got.
hold on one second.
Hold on a second.
Maybe because I have
Oh, I forgot to say that. I forgot to say hi, gorgeous Gigi, our attorney, Dr. Regina. Hi.
I agree. There was a question in the chat. Y'all hear me?
Yes, we can hear you. Go ahead.
Somebody put a question in the chat and wanted the doctor to kind of talk on
What was
uh,
that?
explain the benefits of the circulatory system. That's from a Tim Nelson. I don't know.
Okay. That's out of Michigan.
And Michelle, oh, okay, awesome. So I always remind people of how connected the whole body is, meaning that your spine is not separate from your stomach. It's not separate from your brain. It's not separate from your thyroid. Everything is connected. Everything flows together, which means that if there is dysfunction one place, eventually it does trickle over into other areas. But I say that also to mean that it's involved with your cardiovascular system, your vascular system, your circulatory system. So getting an adjustment, not only is there the increase in range of motion, there is an increase in blood flow as well. There's an increase in nerve flow. Think about a garden hose, and you have a garden hose, you have the water turned on, you're spraying your garden and everything like that. But if you take that garden hose and you bend it in half, you put a kink in it, basically, you don't have any water flowing anymore. You don't it's not nothing's trickling out. So that's where chiropractic can come into play, helping with those restrictions that are in the joint, unrestricting that garden hose, so to speak, and then everything flows. Life flows, nerve conduction flows, blood flows. And so it's a lot of different things that play a role in that. But also with that, again, I stress nutrition because I deal with nutrition a lot as a functional medicine practitioner, and it plays a vital role with chiropractic as well. If you're not getting the nutrients into your body, that the vitamins and the minerals that your joints need, that your muscles need, that your blood needs, then sometimes doing adjustments, they don't necessarily hold very well, or the care isn't as effective because there's a lot of other underlying things going on. And so it's a multi-prong approach. I hope I answered your question a little bit.
Yes. Thank you, Dr. Reid. I wasn't in a space where I was able to ask a question without distracting noises in the background.
Oh, no problem.
But I know that was one thing that always intrigued me that I was educated on very young, and with heart disease running very thick in my family. I thought it was something important that should be relayed to others that were intrigued by what you do.
Yeah, absolutely. Absolutely.
Wow. Wow. I'm just excited. Does anyone else have any more questions? We're almost done. We're almost at that magic hour of 8 o'clock. Okay, Dr. Janice Adams.
I just wanted to make a comment as well and state that I'm honored because Dr. Reid is the very first person of color that I've came in contact with, and I'm in the health and wellness circle to meet, and I'm honored and impressed. Also, you didn't say what led you to go into this field.
Into chiropractic? Well, I always wanted to be in healthcare. I always wanted to be a doctor. And actually, I backed up for a second because I wanted to be a nurse. My mom was a nurse. My grandmother was a nurse. And my mom told me when I was little, she said, no, don't be a nurse. Be a doctor. Don't be a nurse. She said the nurses have to do so much.
I do a lot of work.
And so for a while, I was on the biology pre-med, and I did have a bachelor's in biology from college. And so I was on that pre-med route. But before I graduated, I started kind of looking around. I was like, you know what? I always wanted to be a surgeon, but do I want to be on call? Like, do I want to be woken up at 2 o'clock in the morning to go do surgery? Like those are the things that were in my head. And I was like, no. And so I started looking at more holistic things. And that's where I came upon chiropractic. And that's how I decided to go into chiropractic school. And the nutrition part, incorporating the nutrition part into the functional medicine, is that I always felt initially that I wasn't doing enough for patients. That, coming in and cracking your neck and back and okay, bye, and not addressing the underlying things that they had going on. They had autoimmune diseases, they had diabetes, and not, giving them tidbits here and there. And so that was how I started to incorporate that in, so that it was fully whole body health.
Wonderful, thank you. And is there a book, or when is the book?
You know what? Whatever God wants me to do, if that involves writing a book, I claim it, I accept it.
Well, I'm going to tell you, claim and accept it. I have some people on here that I have a team that can help you if that's something you decide to do. I think that everyone should write a book on their story, and so maybe we'll talk about that on the sidelines.
Yeah, you never know. I love speaking. I am also a licensed minister and soon to be ordained minister. So I kind of cover the whole bases. I end up being a doctor to patients, but end up sometimes being a therapy session. A crying session with patients. So I kind of cover it all. I like people to be comfortable when they come into the office, for sure.
Wow. Okay, Dr. Janice, you've impressed her. She's hard to impress, so she's got another question.
No, actually, no, I don't. I hit that raised button. I was really going to applaud her about her other endeavors as being a reverend, because that's even more impressive.
Yes,
so my parents are pastors. My brother is an associate pastor, and got a little family on here. My cousin Jan on
here. And Miss
so.
Jan, thank you, because Miss Jan actually recommended you. And that's what I ask all of you. We have a tribe here, okay? And I'm looking for people to interview on a weekly basis. And I want to make sure that we're able to educate our communities. So Jan, thank you so much for
You're welcome.
Sharing I know you're
great.
Your cousin.
For my cousin.
Thank you.
My cousin.
So much, because it just worked out well. So does anyone else have any closing comments? Because it is 8:01.
I have closing comments, Dr. B.
Yes, ma'am.
Yes, ma'am. I just wanted to tell Dr. Reid, I'm not surprised that she added that she's an ordained minister, because I felt your spirit through the Zoom. Sometimes you don't need to meet people, but you can feel just looking at the picture or the way they talk or the way they look. And Dr. B knows I don't trust a lot. I don't trust a lot of Zooms, a lot of people, but I felt your spirit through this Zoom. And thank you, Dr. B, for making it happen.
Oh, thank you.
And I'm definitely visiting you with my other twin, who is my mother.
Yeah.
My mother is so we're gonna come see you.
Anytime.
All right, thank you.
All right. Okay, so I have put in the chat her phone number as well as website. So I want you all to definitely get in touch with her. If you're in the Florida area, I'm definitely going to make my way over there, and that's going to be interesting. We'll talk about that because every time I think about cracking a back, that just makes me fearful. But now by speaking to you,
Ease you into it. Ease you into
yes, but no,
it.
and I agree with Maureen. It's all about your spirit, and we're very connected people. I have a small, how can I put it? I keep my I have like a close knit group of people, a network people that I network with. And so we all kind of feel the same thing at the same time, if that makes
Mm.
sense. So just your spirit and the way you handle yourself and the way you've explained everything to us, it makes me feel very calm and I would have no problems coming to you. I don't know if I'm gonna tell you to crack my back, but I'll tell you the way.
It's okay. I have other tools, other ways of doing things too. It doesn't always have to be the cracking, so to speak.
All right. Well, I want to thank you for giving, I know you're busy and just for you've given us a whole hour of your time. But guess what? I think you're going to have probably a good 3 or 4 good brand new customers. So that pays off. And I'm definitely going
Absolutely.
to come down there once I get back. You know, like I said, I'm in Michigan and I love it in both peninsulas. I love it up here in Michigan. It's definitely beautiful. You know, when it snows, I have to invite you up here and, you know, let you see the snow and have a good time.
Absolutely. Yes. Yes, please, please.
All right. Okay, well, everyone, hey, this again, Dr. B Stress Free, real talk for you. And as you guys can see, we bring it on and we have the experts here. And I really appreciate you all attending and look forward to us next week, Tuesday, 7 o'clock Eastern Standard Time. Dr. Reid, thank you so much. You have a blessed evening.
Thank you for having me. Thank you, everyone.
All right, thank you. And you all
Welcome.
have a blessed evening.
Have a good night.
Good night.
Good night.